Okay, everybody, and we're back. I will be recording this lecture if you find some desire to listen to me all over again. I don't know why you would, but it will ask me for that. It'll be in the Canvas lecture for today. It takes about an hour to upload after all this is done, all that good stuff. Okay. So you guys are at the stage of the forums, and we're going to talk about the forums today. We're actually going to talk about how they do some of the neat stuff they do, mainly how they rotate, because your forums, even though we don't call it rotation, when they supinate and pronate, they kind of rotate. You're able to do something very cool, which is take your hand and flip it. And that's not for my upper arm rotating. I can flip my hand without my upper arm rotating. I can roll my whole arm, but that's something different. Yeah? What's happening when my arm rolls this way? What joint am I working and what two movements am I doing when my brachial region rolls this way? Anybody?
GH joint?
It is your glenohumeral joint, 100% correct, sir. It's my shoulder joint doing that, the ball and socket. And what two motions are these? I know I'm not doing them the way you guys are used to seeing them, but Miss Gonzalez?
Is it internal and external rotation?
Yes, it is internal-external rotation. We're more used to seeing me with my arm down like this, showing you internal-external rotation, but this is still internal-external rotation, which, what do we also call internal and external rotation? Somebody?
Medial lateral.
Medial and lateral rotation, yes. So, that's occurring up here. But I can also lock this down, and I can still do this. And what am I doing here with just my forearm?
Supinating and pronating?
I am supinating and pronating. If my hand is up, if it's heading towards up, by the way, like to hold a bowl of soup, I am supinating. If I am prone to spilling that bowl of soup, I am pronating. Yeah?
Mr. Prescott?
Yeah.
Will you put yourself on presenting so we can see you a little better?
Well, I don't mean like no. You can
What?
pin,
Did you just tell me no?
Yes, I did. You can put me on presenting. You can pin me to your screen. If you hover over me, there's a little pin, like a push pin.
I see it.
Hit it.
Yeah, I got you. Okay.
It's even better, huh?
Done and done. You
Yeah.
look so good this morning. Wow.
Miss Puppage, did you not know that this whole time?
No, I did. I forgot. I just
Okay.
forgot. I just
Okay.
I did it.
Sure.
I did it.
You did it?
No, I did not.
Now
Actually-
you do.
Actually,
It's
this
all
is very
good.
helpful because I need to teach the next class this at the beginning of the class. So
Now that we're graduated.
now that you're 7
Okay.
months in, yeah, you guys, now that you're graduating tomorrow. All right. So anyway, now, yes, from your perspective, I'm presenting now, Ms. Cuppage. Yes, I got you. So we're going to talk about that. And by the way, I know this entire kind of process that you've gone through with us. You know, I get to a body part and I'm like, this is the most important body part in the world because it's the feet and they're the foundation of your body. And then we get to the legs. I'm like, but the legs actually have all the muscles that puppet the feet, and so they're super duper important. And we get to the thighs. They're like, well, actually, the thighs are all part of that foundational system. And we get to the hips. I'm like, the hips are the center of your body. They're super duper important. And then we get to the spinal erectors. I'm like, your spine does this amazing thing where it has to kind of like position yourself above your thing and be flexible but rigid. And it's incredible how it does it and uses the back muscles in back and the abdominals in front. It's absolutely amazing. And then we get up to the neck and I talk about the weight of the head, and that's so important. I'm not actually going to tell you that about the forearms. So the forearms are actually not structurally important. You can saw this forearm off right here, and I will basically still walk the way I've always walked. It will not affect my back. It will not do anything. They're not structurally important. So let's just skip this. No, not at all. Because while they're not structurally important, and I will not sell you on that, which I have on almost every other part of the body, they're fascinating. They're absolutely fascinating. So the structure of your forearms which lead to your hands, allows you to do all the manipulations you guys do in massage therapy. They're absolutely incredible. Miss Tops, please.
They're structurally important for massage therapists. We couldn't do our job without them.
Yes, that's true. That would be mechanically important, though, meaning they don't change the structure of your body, but yes, you'd be lost without them. You're absolutely right. And so as massage therapists, we should care a lot. And the fact that I have this unit here that can grab and stuff like that, and it can flip over and go back like this and do all these types of things is absolutely amazing. So, what are the two bones? I know you guys know this. What are the two bones in the forearm right here? Miss Cuppage, what are the two bones in my forearm?
The radius and the ulna.
Yes, thank you. Miss Lopez Moreno, what are the two bones in my forearm?
Radius and the ulna.
Thank you, thank you, thank you. Mr. Nochin, what are the two bones in my forearm?
The radius and ulna.
Yes. Mr. Nochin, one bonus question. Which one of those goes to my thumb?
Which one is the thumb? The radius.
Thank you, sir. Thank you, thank you. He's 100% correct, everybody, right? Radius goes to my thumb, and the ulna is what makes up my elbow and runs to my pinky, right? Right now, these two bones are parallel. In this prone position, these two bones are parallel. My radius is here and here. My ulna is here and here. Yeah? So my radius is over here, right? On this side. I want you to watch this very carefully. It's a little Tapscott magic trick. My radius is now here and still over here. My radius from here just went here over here. That's my radius. It did that like this. If this is my radius, it literally went like this. When you pronate, your radius crosses over your ulna. It's pretty kind of cool. It really is really cool. And we are going to talk today about several things, but we're going to talk today about the muscles that help you supinate and pronate. And a few other little tidbits of information that kind of help you with the forearm too. We're going to talk about some other muscles in there, but that's some of the main stuff we're going to talk about. How you supinate and pronate. How you actually flip those over one another. Yeah? Another thing to kind of bear in mind, this won't tie in directly to the muscles we're studying today, but it's just a way to think about the anatomy of the forearm. Both your radius and your ulna connect to your humerus. You have an humeral ulnar joint, you have a humeral radial joint. They're all down there in your elbow. But the radial connection is very weak because the main job of the radius is to help it flip over the ulna. Your elbow, what makes your elbow strong is your humerus and ulna coming together. Your ulna kind of gets bigger as it gets down to your humerus, and they connect together very well. And so if you really want to talk about the elbow joint, we usually call it the humeral ulnar joint because that's the joint that makes your elbow so amazing. It allows you flexions and extensions. The ulna actually gets smaller as it goes up here, and the radius gets bigger as it goes up here, and your radius actually is the one that makes your wrist joint. It is actually bigger base here, and you usually call it your carpal radial joint because your carpal bones interact with it. And so the ulna touches in there too, but it's not the main thing that gives you your wrist joint. And that makes sense because when the radius flips over, you want it to carry the wrist with it. So that's why it is. So in a way, you've got these two bones, the radius and the ulna. The ulna is very big at the bottom by your elbow. The radius is very small. The radius is very big by your wrist. So the ulna really interacts with your elbow, the radius interacts with your wrist, and the radius can flip over to give you this really cool supination and pronation. So it's a really fascinating design. Yeah. Okay. Cool. All right. let's look at some slides. And we're going to talk about these guys. Bear with me. Here we go. You might want to unpin me now, Miss Cuppage, because what will happen is the display will look small. Okay, so forearms and hands. By the way, before we even go any further, can you guys, anybody tell me what kind of connective tissue this is here, right here around the wrist? I saw somebody mouth it.
That's isohamate.
What type of connective tissue is it?
Retinaculum.
Thank you. Yeah, retinaculum, yeah. I mean, I know where you're going with that, but it's retinaculum. It's ribbon-like fascia. We mainly have it around our wrists and our ankles. And it's just like gymnasts that wrap up their wrists and ankles. It's really meant to provide support for your wrists and ankles. And it allows all these tendons to run, it allows all these tendons to run underneath it and kind of acts as a pulley for them so they don't pop off your forearm. All right, moving right along. Today, some of the other stuff that we're going to look at is also, I know I said supinators and pronators, and we will. You've kind of got two supinators, you've got two pronators. But we're also going to look at this muscle that comes down from the brachial region down the radius, called the brachioradialis. We're going to look at that because this muscle and the ulna bone divide your flexors from your extensors. Super duper important for the end of the year. And I'll explain why in a second. So we'll look at that. We're also going to look at a muscle that you've already looked at that's underneath the biceps brachii, which is the brachialis. But let's move right along. Pass all this right now. Bear with me. Bear with me. Okay. This should look extremely familiar to you. You've learned this already. If we cut your biceps brachii off your arm, off the anterior part of your humerus, underneath there is a muscle that's actually responsible for the size of your biceps brachii. It actually is the bigger muscle. When people are doing curls at the gym and they're like, I'm doing bicep curls, they are, hold on, I'm just going to mute Miss Cuppage here. There. Nothing personal, Miss Cuppage. There. When people are doing bicep curls in the gym, they're really doing brachialis curls. I mean, yes, they're doing bicep curls too, 100%, but they're really doing brachialis curls. The brachialis goes across the humeral ulnar joint, and it only has one action. All day long, all it can do is flex your elbow. That's it. And they put it in this section of your book because it has more to do with your forearm than your upper arm. Like it connects down to your forearm and it doesn't go across your shoulder. Anyway, that's the brachialis. You should be familiar with it. It is deep to the biceps brachii. There's only two muscles really in your anterior humerus, and that's the biceps brachii on top and the brachialis underneath. Yeah? And it's powerful. Cool, cool, cool. So if somebody were to ask you what's deep to the biceps brachii, you would hopefully say the brachialis. Yeah. Can anybody... Let's stop sharing for 1 second. Can anybody explain to me what position it might be good to have somebody's arm in if I was rubbing this area, this anterior portion of the humerus, and I wanted to get to the brachialis? What position might I want my client's arm in to make it easier to get to the brachialis? Make it easier to get through the biceps brachii to the brachialis. Yes, Mr. McClure.
I do it prone.
Okay, so they're You mean they're laying prone? Is that what you mean?
They're prone, yeah. And then bend their arm and take it up. And so their forearm's hanging.
Okay.
And then it shortens the brachialis and the biceps brachii. I pull on it, and then I'll hold the elbow and push forward. And you can really dig your fingers into the bellies of those muscles.
Yep. I think I agree with you 100%.
It kind of hurts, but
Yeah.
it feels really good afterwards.
So if I'm interpreting him correctly, he's correct. Let me just say it a different way. When my arm is out like this, the biceps brachii is actually stretched. And it's a little bit tight, and it's making it hard for me to get to the brachialis. If I move the client's arm in, look how loose this gets. It just flops around, which means the biceps brachii is not tight anymore, and I can get through it into the brachialis. This is why we learn anatomy. It's one of the many reasons we learn anatomy. So now if the client moved it, it would be tight. But if I move it for him, that is loose, and I can telegraph through it, I can get through it and get to the get to the brachialis. Yes, Mr. Kachekian.
Would that be considered shortening it?
I'm making a big sigh because I find that the book makes this confusing. Yes and no. So if the client does it, sir, muscles can only do one thing, contract, shorten, and you'd be 100% right. This flexing action would be shortening that, right? But if I do it for the client, the muscle never shortens, and what we have is a lot of slack in here. So you're not
So
wrong.
between active and inactive, if it's
Is the
actively
difference.
doing it,
It'll-
it's shortening. If it's
If the client's passive, then you're gonna have all this slack in the muscle, and that's what we're trying to do in this case. That was dead on accurate, sir, what you just said there.
okay.
Yeah, and it's a really important point in massage, right? Because we're often trying to passively move something for a client so that it's loose and we can get to deeper layers. Yeah. Now, Mr. McClure is also going on and mentioning some other kind of neat things where he's pinning and stretching the muscle as well. But anyway, but just the point of getting to this, we are putting this muscle in a loosened position on top to get to the muscle below. Well said. Thank you. Okay. Let's move right along. That's the brachialis. By the way, you can obviously access the brachialis from the sides of the arm too. It's directly under the biceps brachii, and you can rub it from the sides. I was really trying to make a point about kinesiology. All right, this should be sharing. Okay, brachialis, right there. Boom. Moving right along. They're showing you here that it is underneath the biceps brachii, by the way. Here's the biceps brachii. Here's the brachialis right underneath it. All right. Brachioradialis. Brachioradialis attaches to your humerus up here, and just like the name says, it goes to the tip of your radius. It's literally called the upper arm radius muscle, right? Brachio from the brachial region. Radialis to the radius. And they say some confusing things in your book here that it can help to pronate and supinate, which is true, but it sounds really confusing because most muscles can't flex and extend. So why would they be able to supinate and pronate? And it can also help to just flex the elbow. And I'll explain why here in just a second. Mr. McClure, please.
Is that the largest muscle in the forearm?
Is that the largest muscle in the forearm?
Sorry, is that the
Longest?
big belly right here?
Yeah, well, yes. So I don't know if you can see, like, it's not like I have great, like, musculature here, but it is this muscle here. It is actually this muscle right here. Going down here. I don't know if it's the largest. It's big. You got some pretty powerful digitorum flexors in your forearm too. Like a lot of this is not one flexor, but several flexors in there.
Okay.
The reason it can help to supinate and pronate.
Typically.
What?
I should have said typically the largest.
Yeah.
That was more what I was saying.
Yeah, well, I just don't know actually how to analyze it. It's super significant, and let me tell you why. one thing is it does go, if you can see me here, it does go from my humerus down to my radius, and it can help me do a curl. So now when you're in the gym and you're doing bicep curls, what you're really doing is mainly brachialis curls, then biceps brachii curls, and you are doing brachioradialis curls. It does help in curling. It does help in flexion of the forearm. It helps you do that. Because it ties these two areas together, it shortens, and it does that. The reason they say it can help to supinate and pronate is because it runs down this part of my arm here. When my arm is way over like this, it can help to pull it up this way. When it's way over like this, it can help to pull it back this way. So it can help get you halfway through a pronation or halfway through a supination. It can help you go back and forth. It can't pull you all the way over, but when you're halfway over, it can pull me back up to what we call neutral. When I'm halfway this way, it can pull me back up to neutral. That's why they say it can help with supinating and pronating. I don't think of it when I think of supination and pronation. We're going to learn about specific muscles that help with that. I just want to explain why the book says that. Why do I really care about this muscle? I mean, don't get me wrong, it's important, the action of the elbow. Super important. But I care about it because it allows me to divide the flexors and extensors in the forearms. And when we get into flexors and extensors in the forearms, which is the next couple of days, there are a lot of muscles and they can be kind of confusing to remember. And if you realize that the brachioradialis that goes from the humerus up here to the radius and my ulna down here create a division between your flexors and your extensors. All of my extensors, did I mention all of my extensors are on my posterior forearm? They're all in the back. All of my flexors are in the front. All of them. And if I'm on flexors here and I get to an ulna and skip over it, I'm now in extensors. If I'm on flexors here and get to the brachioradialis and skip over it, I'm now in extensors. But it's even more than that. And Ms. Cuppage, you actually might want to pin me to your screen for this, if you haven't already. I don't know why you'd ever take me off. So.
I'm on.
Cool. So, all of my flexors are in my anterior forearm, and they all essentially go to the medial epicondyle of my humerus, which is kind of diagonal. I don't know if you can see that, but it's kind of diagonal. So when you're rubbing them, if you're rubbing flexors, you're always heading towards the medial epicondyle of the humerus. Always. All my extensors go to my lateral epicondyle. Whoop, sorry. No problem with my extensors. Like that. They all head and start to veer off over here. It might seem like a small point, but when I'm rubbing somebody's forearm, like from distal to proximal, I'm working off at an angle because I'm following those muscles down to either the lateral or the medial epicondyle. If I'm rubbing the back of your forearm, I'm heading off this direction because they're eventually going over here. When I'm rubbing the anterior forearm, I'm heading off towards the inside of your arm because that's where they go. They don't actually go straight down. And so it's super important in just being a better forearm rubber. You know, and this class, when you guys are becoming as advanced massage therapists, and those little nuances matter, right? So I'm not actually just rubbing a forearm straight like this. I'm actually twisting a little bit to follow the origin insertions to where they go. And I separate all of those by the brachioradialis and the ulna, by a muscle and a bone. Now, why is that helpful? Because there's a boatload of flexors and extensors in your forearm. And just memorizing them is really annoying. And so I've given you little tricks to remember them, tricks that we will test you on at the end of the year. So at the end, let me give you an example. Because I think this is information you can retain for 20 years. That's why I put it this way. If I have a muscle on the anterior forearm if I have a muscle on the anterior forearm, and it's going to my thumb, what is that muscle probably called? Anybody, raise your hand.
Pollicis.
Flexor.
Flexor.
Raise your hand if you're confident about an answer there. Miss Zwick.
Probably flexor hallucis longus.
I'm sorry, how did you spell that? Flexor what?
Pollicis. Flexor pollicis
pollicis with a
longus.
P. Yeah, she's right. Flexor pollicis longus. And let me be very clear. You guys have asked me this before, but I want to be really clear about this. There will not be an answer on the test that says flexor pollicis brevis. I'm not actually interested in whether you, because usually longus would be correct. Miss Zwick is correct, but I'm not trying to test you on that. What I'm trying to test you on is, do you know the flexors are on the anterior side? Do you know the extensors on the anterior side? Do you know that when it's on an anterior side going to the thumb, it must be flexor pollicis? Do you know when it's on the anterior side and it's going to all these fingers, it must be flexor digitorum longus, but flexor digitorum, because I know you can remember that information for the rest of your life. I don't care about all the little nitpicky stuff, right? But I don't want somebody to walk into your room and saying, I'm having a problem with my forearm flexors, and you're like, I don't remember which side of the forearm that's on, you know? Or they're like, when I move my fingers, it hurts, and you're like, you should be able to guess at these names. So if it goes to the little pinky, it's going to have digiti minimi in it. If it goes to the fingers, it's going to have digitorum in it. If it goes to the thumb, it's going to have pollicis in it. If it's on the front side, the anterior side, it's going to be a flexor. And if it's on the posterior side, it's going to be an extensor every time. Every time. You know, that's a wonderful rule that covers about 15 muscles, right? Just remember, by the way, you don't normally see people's anterior forearms. We walk like this. I walk medially or internally rotated. That's normal. So you're actually looking at the back of my forearms right now. When I stand in anatomical position is when you see my anterior forearm. Yeah. Questions, comments, thoughts, anything? For the rest of your life, remember pollicis means thumb. And you will do well.
Question, real
Yes.
quick.
Please, real slow even.
On the test, I know you said there's going to be like a lot of just images of muscles.
Yeah.
Are you going to like kind of switch it up between like views? Like, are you going to give us an anterior view with their arms like that?
Yes, that could happen.
If it's not an anatomical position.
Yes, that could happen.
It's going to be like mixture.
Yes.
Okay.
So on the one hand, I feel like the test is easy because if you remember stuff like extensors on the posterior forearm and stuff that goes to the fingers, it's digitorum, you can answer the entire test. I really believe that. But I don't make it easy in the sense that I don't have a picture of a guy standing like this. And there's even stuff where people are like, well, that was kind of confusing. I'm like, not if you knew what that bone was, right? Like, you should be able to kind of look at stuff and be like, oh, I know what bone that is, and I know what's going on there. We expect you to really know your anatomy. But it's not set up tricky like, oh, Miss Smith, you told me brevis and it was really longus. I'm not looking for that. I'm looking for like, you know the quadriceps femoris, you know those four muscles, you know it was on the outside of the leg, so it had to be vastus lateralis, you knew this kind of, that kind of stuff. Yeah. But how they're standing, yes, who knows? Yeah. Good question. Okay. So the brachioradialis is important because it divides the front from the back, the flexors from the extensors. I mean, yes, it's important because it helps your body move and it helps you supinate and pronate a little bit and helps you create a flexion of the elbow. But it's a really nice dividing line. That and the ulna divide flexors from extensors. I know I'm running that in the ground, but it's like some of the most important takeaway from this. If you remember nothing more from the entire forearm section, nothing more than flexors are on the anterior side, extensor. This, by the way, this is it. This is your whole cliff notes for the entire forearm part of the test. I guarantee you, for at the end of the year. For forearms. If you remember nothing more than flexors on the anterior side, extensors are on the posterior side, They're divided by the ulna bone and the brachioradialis. Muscles going to the fingers have the word digitorum in them. Muscles going to the thumb have the word pollicis in them. And muscles going to the little pinky have digiti minimi in them. If you remember, one other thing I would throw in there is, if you remember, muscles that are on the outside of the body can pull stuff out, so they tend to be abductors. You can start to answer almost anything with fingers and hands, with forearms and hands. I mean, just that right there. Miss Stewart, please.
I was just gonna say too, one thing you said earlier in the year that really helped me. Obviously, the only thing muscles can do is contract or shorten, so that will just go to show the action of the muscle, because it's shortening is its action, or you know what I mean?
I know exactly what you mean, Miss Stewart, and I actually really appreciate. I think Miss Stewart probably just mentioned my number one thing, right? That I've said the whole year long. Muscles only do one thing, and that's contract. And what she means is, if it can only do one thing, you can start to figure out, like, what would have to pull to make this action happen, and therefore that muscle has to be there. You can't pull from the back. I can pull from the back, but then I go towards the back. And so you can figure out any muscle's action. You just go, like the pectoralis major. It's right here. It goes over to my humerus. What's it going to do if it pulls? Horizontal adduction. I mean, it does other things, but that's what, yeah, you can even see it's going to do a medial rotation. It's going to roll my arm in.
Yeah, like just by like its position on the body, you could tell so much about its properties, which is really cool.
Yes. Actually, if you know the origin insertion of any muscle, and you know that it can only pull, that's it. You can figure out the action. 100% of the time. And by the way, guys, you might think I'm doing this for your benefit. This is literally how I take a kinesiology test. I sit there and I'm like, oh, brachialis. Let's see, it goes from here to here. If this shortens, what do I call it? Oh, that's a flexion of the elbow. That's the answer every time. It's literally what I do. I don't ever memorize actions. You can figure out anything. Thank you, Ms. Stewart. Probably the most important point to highlight ever in this entire class. Okay, moving right along. So we've looked at the brachialis underneath the biceps brachii, which you've already heard about. We talked about the brachioradialis. I've beaten it like a dead horse, that it divides your flexors from your extensors. All that good stuff. And now, very easy to palpate, very fun to palpate. Oh, Mr. McClure, sorry, sir. You have your hand up.
Trying to figure it out on my own, but does the pinky from anatomical position, well, I guess it wouldn't matter, does it abduct or adduct?
Got you.
So does the thumb?
So actually, no, sir, you bring up a really good point. We talked about this a long time ago, but I'm really glad you brought it up again.
Is there another midline in the hand?
Yes, that's exactly the answer. So when it comes to your actual fingers, we talk about them moving from their own midline. So I am abducting all of my fingers right now and thumb. I'm adducting all of them right now. We don't talk about it from relation to the body. We talk about it from relation to itself. Now, that's not true with the wrist. The wrist, I hate to tell you right now, this is going to kill you, but like the wrist, you have to put them in anatomical position. So this really is adducting, this is abducting. It's going away from my whole body. And so if I flip that hand over, it changes everything, all that kind of stuff. But fingers, we talk about it as though the hand is the body. So this is me abducting my pinky. This is me adducting it. This is me abducting my thumb and adducting it. They go off to both sides. Pretend like they're your arms or something. That is you, yes. That is Spock abducting.
Live long and prosper.
Yes. Miss Gonzalez. Yes, ma'am.
A couple of things I wanted, I guess, to clarify. Okay, first is, I've heard an anatomy teacher help us remember abduction and adduction as taking the ad with it's adding to the body.
Yes.
Have you guys, is that how y'all remember it?
That's how,
Okay.
yeah, that's how I remember it, yeah. I think many people here do.
Okay. And abduction. So, I don't know, for me that always helped.
It does.
To remember anything that's adding is adduction.
Yeah. Adding
And
back
then
to the
anything-
body. Adding back to the midline.
Right.
Absolutely.
Yeah, yeah. And then also, the term shortening the muscles.
Mhm.
So I guess to me, or maybe as a client, it might imply that the muscles lose length. Is that what is being said or implied when anyone is mentioning the muscles shortening?
Yes, that is like, so when a muscle contracts, it truly does shorten. I don't know if that answers your question, but when a muscle contracts, it truly does shorten. In order for you to move anywhere, muscles are shortening. I mean,
Sure.
other ones have to let go, but yeah.
Would it be more speaking to the elasticity of the muscle rather than the actual physical length? Do you know what I mean?
Well, muscles have to have an elastic component to lengthen again. That's true. So my agonist, the muscle doing the work, shortens while my antagonist shows elasticity and lengthens.
Okay. Okay, thank you so much.
Thank you. Mr. Kachekian, sir.
So when you're talking about the hand and you're talking about the fingers abducting and adducting, would you say that it's important to like divide the hand this way, like in between, so that you don't think of the hand as of the fingers all as one piece? So that kind of makes it confusing when you're saying adducting and abducting and adducting. So you think of this as a separate entity, and this is separate one, and this is separate one. So this is like adducting, this is abducting.
I like what you're saying, but I would only make that separation right down the middle.
Just down the middle.
Yeah,
okay.
between digits 3 and 4. So kind of like
Sorry if I made that confusing.
No. I know what you were going at. Actually, it was very clever. But no, make it down the middle only.
Make it down the middle only.
Yeah.
Okay, got it. Thank you.
Thank you, sir. Okay, everybody. I forgot about this muscle, by the way. We're just going to go over it briefly. But it's called the anconeus. It is in the back of your arm here. You can actually feel it a little bit. It goes over to my lateral epicondyle here. And it helps your triceps, by the way. Your triceps are your major elbow extenders, right? They're powerful. 3-headed triceps, powerful. The anconeus is a weak tricep extender. You can actually feel it if you find your ulna right here, which goes to your elbow right here, and you fall off laterally. That's that muscle in there. There's a little muscle in there, and that's called the anconeus. Goes over the lateral condyle here. It's very small. It's about the size of my fingers right here. If you can see this. It's right in there. I don't mean you can see the muscle, but just my fingers here. And it's right off. I find the ulna here fall off right there. That's the anconeus. It's a weak elbow extender. So it helps the triceps. You probably use it at times you have to extend your elbow and you don't need a lot of strength. That's what's back there. I don't have a lot to say about it. I just want you aware that it's there. And it is kind of a muscle you have to kind of memorize. It doesn't sound like anything else. It's just, it's just there. And I haven't, by the way, in my personal practice, haven't found it cause a lot of problems. Doesn't mean you'll never find that, but I just haven't. I haven't run into a lot of problems where I'm like, it's the anconeus. So, okay. So, actually, before I get to those, yes, Miss Cuppage, please.
I think one of the funniest things that we've run across with the forearm is the Lister's tubercle. Like, the thing that's named after somebody that started, I think basically antiseptic. It's like, this is like the only, and hamstrings just kind of blow my mind too. Like, everything else is all technical and Latin and Greek and everything, and then we've got Lister's tubercle.
Yeah, and it's because the body was named by so many different people, right? The portions, and so it's kind of like you discover something and you get to name it whatever you want. And a lot of people were good and stuck with Latin, and then other people are like, no, that's Tapscott's pyramid. You know? Yes, you're absolutely right.
That's pretty funny.
It's good, actually. I think it's funny because you'll never forget it. Okay. So we're now going to talk about pronators and supinators. You have 2 pronators that help you to flip your hand over and dump out your soup, prone to dump it out, and you've got 2 supinators. You have already learned about your most powerful supinator. You've already learned about one of your supinators, and I wonder if somebody can tell me what one of their supinators is that you've already learned about a long, long time ago. Miss Magruder, you have the floor.
I think it is biceps.
Biceps femoris or biceps brachii?
Brachii?
Miss Magruder, you are brilliant. Miss Magruder is 100% correct. Your bicep, because the way it hooks into your forearm, yes, it causes a flexion, but it actually causes a supination. This is why bodybuilders don't usually pose with their wrist out like this. They turn it in, and it makes the bicep go up more. Because the bicep also pulls your arm in. It actually creates a supination. Good job, Miss Magruder. Biceps brachii is your one of your supinators. We're going to learn about the other one. And then you've got 2 pronators that we'll learn about too. But you already know about one of the supinators. By the way, guys, do you suspect, because the biceps brachii is one of your supinators, that you are a better supinator or a pronator? Are you stronger at supinating or pronating?
Supinating.
Supinating. She is 100% correct. You are better at supinating. You are stronger at supinating. And that is the reason that screws go in clockwise. Door handles usually get turned clockwise. We have built our life around the fact that you are a more powerful supinator than you are a pronator. So things have actually been designed to work that way. Screws actually are made to screw in so that you can supinate as a right-handed person and supinate them in. Yeah. We're not very fair to left-handed people. That's a whole other discussion. But that's truly why it's done that way. All right. Let's talk about pronators. You have 2 pronator muscles. Both of these are on the anterior forearm. Both of these are on the front of your forearm. One is called the pronator teres. The other one is called the pronator quadratus. But here's the pronator teres. It is simply a little muscle that goes from this medial side of your arm down to this lateral side of your arm. So from the medial epicondyle here, over here, and when it pulls, if we do what Miss Stewart's taught us to do, it will pull my radius over. It will pull my radius towards my medial epicondyle. It will pull it because muscles can only contract. They can only shorten. That's the only work they can do. It will pull this over, and it will make me prone to dump out my soup. And that's the pronator teres. If you were going to work it on somebody, it really helps to pin and stretch and pronate and supinate their forearm while you're doing it. Makes sense, right? And you go for the medial epicondyle, especially around the medial epicondyle, and pronate and supinate, and you'd be getting the insertion of that muscle really well. Yeah? Easy peasy. Cool. Wait 1 second. All right. That's pronator teres. Pronator quadratus. Why is it called the pronator? What? I know it's called pronator because it pronates. Why is it called quadratus? Somebody? Why is this muscle called quadratus?
It has 4 sides.
It has 4 sides, Miss Tops. Miss Tops, don't remute yourself. I'm not done with you. Miss Tops, you are brilliant. It is. She's like, don't. It's 4-sided. She's 100% correct. Miss Tops, have we learned about other 4-sided muscles that are also called quadratus?
Yes, we have.
Good. Do you know any of their names?
Quadratus, we have the...
One is an abdominal muscle, and one is a deep six lateral hip rotator.
Quadratus laborum.
Yep. Quadratus laborum, the four-sided abdominal muscle found in your lower back, in the lumbar region of your lower back. Yep.
Yeah. And the deep six one is the quadratus femoris.
Quadratus femoris, the four-sided muscle that hooks to your femur. Yeah. So
When
you
I
got
seen another quadratus, I went crazy. I was like, oh my gosh, another one.
So there are actually, we now know 3 muscles that are called quadratus because they look kind of like rectangles. They look like four-sided figures. By the way, if you guys look at this one's really easy to kind of understand. It's about the size of 2 fingers, and it's right here on the front of your wrist like a tiny bracelet right here. And you can rub it in there. If you massage in here, everybody, feel free to massage in here, but the endangerment site is right in the middle, right? Right? We avoid pits. Right? We avoid arm pits, elbow pits, wrist pits, knee pits, I don't know, neck pits even, right? But you feel free though to hop off, just like the axillary region. I don't poke right in their armpit, but I go to town on the sides of it, right? You can go to town. I mean, elbows, baseball bats, right? Just go nuts. Just don't go straight in there. Same thing with the wrist. Don't be afraid of rubbing on the sides here. Just don't go right into center because that's where all the nerves are and the arteries and the veins, and you'll make them mad. Yeah. Okay. So that's the pronator quadratus. So we've got a pronator teres that's proximal and a pronator quadratus that's distal. And they're both on the anterior arm, and they help this flipping action. They help to pull the radius over the top of my ulna. Yeah? Yeah. Okay, good. Let's review pronators. We have 2 pronators. Miss Smith, what are the names of the 2 pronators? And I'm sorry because I know you're eating. She's like, just the 2 names.
The pronator teres and pronator
four-sided muscle.
Quadratus.
Perfect, thank you.
Quadratus.
That was perfect, thank you. Mr. Bigelow, what are the names of the 2 pronators?
The pronator quadratus and the pronator teres.
Thank you, sir. Miss Vega, what are the names of the 2 pronators?
The pronator teres and the pronator quadratus.
Thank you, ma'am. Mr. Penrod, what are the names of the 2 pronators?
Teres and quadratus.
Wait, yes, that's right. Mr. Penrod, you're really throwing me off too because you're like sideways right now. Anyway, that's all right. It's good for me. I feel like we're in outer space. And now okay. Mr. Penrod, which side of the forearm can I find the pronators on? Anterior, posterior, lateral, medial?
I have to think about it.
Yeah, I want you to think about it.
Anterior.
He is right, by the way. Both pronators are found on the anterior side of the forearm. Yes, sir. Which one, so they're both on the anterior side of the forearm, which one of the pronators is more proximal?
Teres.
Yes, pronator teres is more proximal. It's closer to my body. Which pronator is more distal, sir?
Quadratus. Quadratus.
Thank you very much, sir. It's been a pleasure. Yes. Miss Dowler.
Hi.
Miss Dowler, what are the names? Hello. What are the name of the 2 pronators?
The pronator teres and the pronator quadratus.
Yes. Which side of the forearm are they found on?
The anterior side.
Yes, ma'am. Which one is more distal?
The pronator quadratus.
Yes, ma'am. Which one is more proximal?
The pronator teres.
Yes, ma'am. Last question. What is the action of the 2 pronator muscles?
Pronate.
Yes, ma'am. Thank you very much. To pronate the forearm. Yes, that's perfect. Thank you. Sorry, it sounded like a trick question. I didn't mean it that way, but it did. Yes. Miss Ratana. Looks like she's dancing. She's kind of like grooving up. Miss Ratana, that's okay. What are the name of the 2? What are the name of the 2 pronator muscles?
pronator terry and the pronator quadratus.
Perfect. Thank you, ma'am. That's good. All right, everybody. I think this is a good place to take a little break. Yeah? Yeah? Okay. Things are going swimmingly this morning. Let's just take a 15-minute break. Come back at 10 o'clock, okay? 10 o'clock. Don't be late. See you then. Bye. Okay, everybody. We are back to continue this riveting discussion of forearms, which I said were not structurally important in the body, but as Ms. Tops pointed out to all of us, where would we be without them? We certainly wouldn't be massage therapists. So, we just talked about, we kind of actually reviewed some stuff like the brachialis that just helps you to flex your forearm that's underneath the biceps brachii. Then I went on in gory detail about the brachioradialis that kind of runs down my radius from my brachial region and divides my flexors from my extensors. I made a big deal about the fact that all you really need to know in this world about forearms is that all the flexors are on the anterior side, all the extensors are on the posterior side, that the brachioradialis muscle and the ulna bone divide those two things. The things that go to the fingers are called digitorum, things that go to the thumb are called pollicis, things that go to the little pinky are called digiti minimi, stuff on the outside of the hands probably abducts, stuff on the inside, deep inside, probably adducts, and bam, that's it. And then we talked about pronators, and we discussed that you have two pronators, one that looks like a little rectangle that's on your wrist here on the anterior side, which is your pronator quadratus, and then one that's much more proximal, which is your pronator teres, both on the anterior side. And now we're going to go on to supinators. And Ms. Magruder was kind enough as to tell us the most important and most powerful supinator already, which is the biceps brachii, which I made a big point that that's why bodybuilders actually turn their wrist in to further contract and shorten and get a bigger head to their bicep, because the biceps brachii is this powerful, powerful supinator. But there is a much weaker supinator that you also have in your anterior forearm, believe it or not, that's very hard to palpate. Not impossible, but hard. And I'll show you. Well, actually, before I show you a picture of it, it is this tiny muscle that it is on your anterior forearm, but it's deep, deep in there, and it's wrapped around essentially on the anterior part of your radius. And it's wrapped around there to help pull your radius over to your medial epicondyle of your humerus, by the way, but it's deep inside there. I'll show you a picture of it, but you'd have to actually kind of pull these muscles off the front, and it's like a little thin muscle kind of wrapped around the proximal part of my radius, and that's why it's hard to palpate. You can do it, you can telegraph to it, but it's just a little more challenging. Let me show you a picture. Hopefully it helps. Picture's worth 1,000 words. Here we go. All right. So, this is your elbow joint, right? Your humeral. Make sure I got my pointer here. There we go. Your humeral ulnar joint right here. This is your radius. This guy is wrapped around really in front and helps to pull your radius over. Here's a good picture of the front right here. And it kind of covers up this part of the radius right here and will actually tie it to your lateral epicondyle of your humerus, and so therefore it can pull your arm over to the lateral side, which if you think about it, your forearm rolling laterally, rolling out, externally rolling, is your forearm supinating. And that's what it does. It's not even 1/10 as strong as your biceps brachii in supinating you, but it is a supinator. And you probably use it a lot when you're doing really small, detailed work with your hands, where you don't need a lot of power. When you're screwing in a screw, you're using this muscle and your biceps brachii, especially your biceps brachii. But when you're doing really gentle movements, you're probably using this muscle. It gives you really fine control over how you rotate your wrist, because we do lots of stuff as human beings. Really, as human beings, one of the things that makes us human beings is our hands. And if you are painting or sculpting or doing some very detailed kind of beautiful work with your hands, the ability to be able to gently turn your hand and control minute movements becomes very important. And you would definitely use your supinator for angelic movements like that. Yes. So that is your supinator. And it too is found on your anterior forearm, basically kind of wrapped around the proximal end of your radius and hooks over to your lateral epicondyle. And don't get me wrong, you can kind of feel it. It's just a small muscle and it's underneath an awful lot of muscles. And so when I'm trying to work it, I don't so much try to feel it. I try to find the radius and rub the radius and don't worry so much if I'm actually feeling the supinator or not. I just roll the arm back and forth and get my hands around the radius in there because that's where the supinator is. And then I supinate and pronate the forearm, so I'm pinning and stretching it, if that makes sense. I hope it makes sense. Boom. Here's a good action of it right there. This person's hitting it from the side, which actually is probably the best way to hit it from instead of from the top. It's underneath the top muscles, underneath the anterior muscles, but probably easier to hit from the side. Yeah. Cool beans? Okay. So, Miss Tops, please.
Would you ever use a supinator by itself without using the biceps brachii, if it just turned?
It's a fantastic question. I don't know the answer because I don't know exactly how our brain puts all that stuff together. I would suspect you do. I would suspect on small, gentle movements that you use just your supinator alone. But the only reason I'm doubting that answer is because your brain often uses multiple muscles when it's doing everything. And so I just don't know. I just don't know. And I don't know the name of those.
Would it be smart to think of the supinator kind of like the helper to the biceps brachii?
Yes. Yep. In fact, we might call the biceps brachii in a supination movement, we call it the prime mover. They're both agonists, but it's the prime mover, which means the major mover. And the supinator muscle in a supination movement might be the synergist, a muscle that works in synergy with it, that helps it. Absolutely a helper muscle. It's a perfect way to put it. I think that's very accurate. Yeah. And by the way, I'm 100% positive somebody could train themselves to supinate their forearm and not use their bicep at all. I mean, you could train your brain to shut one. I don't know why you'd want to, but my point is, yes, it could be done. Yeah. But I don't know if the brain separates them out that much or not. Yeah. I'm assuming it's doing exactly what you talk about. It's getting power from the bicep and using the supinator to control the finer movements. Yeah. If that makes sense. I hope it does. Any other questions, anybody? Okay, let's review all this stuff and then do some homework and leave time so that you can do your homework and so you don't have to do it tonight. That would be nice, right? I think that's a good goal. Yeah? Okay. Miss Vega, you have two supinator muscles. What are their names?
The biceps brachii and the supinator.
Yeah, perfect. Thank you, ma'am. Mr. Penrod.
Hello?
Hello. You have two pronator muscles. What are they called?
Teres quadratus. Well, teres and quadratus.
Pronator teres and pronator quadratus?
Yes.
Okay. Thank you, sir. Mr. Nochin. Mr. Nochin? Going once? Going twice? Mr. Nochin? Last call for Mr. Nochin. Okay. Miss Kilpatrick, you've got two supinator muscles. What are their names?
Bicep brachialis and yeah, she said I forgot the other.
Biceps brachii.
Bicep brachii.
And the other supinator muscle. What would be a good name for a supinator muscle?
Look, I think you just said it. I don't know.
Well, I'm trying to give you a hint. What would be a good name for a muscle that supinates?
Supinator?
Yeah, that's it. Thank you, ma'am. Miss Mitchell.
Yeah.
What are the two supinator muscles?
The supinator and the biceps brachii.
Awesome. Which one's more powerful?
The biceps brachii.
Yeah. What are the two pronator muscles?
Pronator teres and pronator quadratus.
Awesome. Thank you, ma'am. Thank you. Miss Langford. Hi.
Hi.
Miss Langford, what are the two supinator muscles?
Biceps brachii and the supinator.
Thank you. And what are the two pronator muscles?
The pronator teres and the pronator quadratus.
Yeah. And I haven't asked this question this way before, so I hope it doesn't make it more confusing than it is. Basically, which side of the forearm, or humerus, because some are kind of on the, but which side of the forearm can all of these be found in a way? Anterior, posterior, lateral.
Anterior.
Yeah, really well said. They're basically, I mean, you got way distally here, you got the pronator quadratus. Proximally here, you got the pronator teres. A little bit over here, wrapped around the radius, and a little bit to the side, I admit that, but still in front is the supinator. And the biceps brachii is coming down and attaching in front too. Excellent answer. Thank you, Miss Langford. It's exactly what I wanted. Miss Lopez Moreno.
Hello.
Hello. Miss Lopez Moreno, what are the two pronator muscles?
Pronator teres and pronator quadratus.
Awesome. And what are the two supinator muscles?
The supinator and then the biceps brachii.
Yeah. Out of all four of those, what do you suppose is the most powerful muscle?
The biceps brachii?
Yeah, you're 100% correct. It's just so much bigger than all of them. Which means, what are you more powerful at doing, supinating or pronating?
Supinating.
Yeah, she's 100% correct. Cool. Thank you, ma'am. Mr. McClure, there is a four-sided muscle that you can find on the distal anterior forearm. What is that muscle called?
Pronator quadratus.
Thank you, sir. What's the action of that muscle?
Supinates. Did I get it?
Do you want to? What was the name of the muscle again?
Oh, pronates.
I thought you were making a joke at first, and then Mr. Bigelow goes, scratches his head. It was good. Oh, thank you. Okay.
Yeah, he was just joking.
Yeah, he was joking. Awesome, sir. Yes, the pronator pronates. Yeah. What's the action of the supinator muscle, just to make sure?
Supinates.
Cool. Thank you, sir. That's wonderful.
In my brain, I said pronates, but my voice said supinates.
I actually do it all the time. I really do. Very good. Thank you. Okay. So, what muscle lies deep? What muscle lies deep to the biceps brachii, Miss Cuppage?
That would be the brachialis.
That is true. Thank you very much. Yeah. What muscle lies superficial to the brachialis, Miss Dowler?
Sorry, can you repeat that?
Yeah.
I'm reloading.
What muscle is superficial to the brachialis?
The biceps brachii.
Yes, thank you, ma'am. Thank you. What muscle divides my forearm flexors from my forearm extensors, Miss Smith?
Your brachioradialis.
Yes, ma'am. Thank you. Beautiful. Thank you. What bone divides my forearm flexors from my forearm extensors, Miss Zawick? Miss Zawick? I can see you. Miss Zawick. Miss Zawick. It's so weird when you can see somebody and they can't hear you. Let's try something. Hold on, everybody. See if she's looking at the screen. Miss Zawick? Losing you guys are dropping like flies, man. All right. Zawick. 16. Okay. Which reminds me, Mr. Nochin, are you still not there? We lost him. Okay. What? Miss Zawick. Miss Zawick.
Hello.
Hello, welcome back. Miss Zawick, what bone divides your forearm extensors from your forearm flexors?
Your forearm flexors and extensors.
What bone separates those two?
Your radius? No, ulna. Both? Oh, forearm flexors and extensors. Not wrist flexors and extensors. Your humerus.
I did mean wrist and finger forearm extensor.
Oh,
You sure it's not your
you said
femur?
forearm.
What about the tibia?
What?
What about the fibula? I'm just messing with you right now. It is your ulna. Let's go back to ulna.
Okay.
Yeah. You doing okay? Kind of, sort of. Yeah. Okay. Ulna.
Kind of, sort of.
All right. Thank you, Miss Swig. Yes, yes, yes. If I want to find my forearm flexors, and by the way, guys, when I'm saying forearm flexors, she does bring up a really good point. I mean things that flex my wrist, flex my fingers, do all sorts of flexions. If I want to find my forearm flexors, which side of my forearm would I look on, Miss Ramirez? Miss Ramirez, which side of my forearm do I find my flexors on? You can't hide. You can run, but you cannot hide. Which side of my forearm do I find all my forearm flexors?
Interior.
That is correct. That is really correct. That is really excellent, Miss Ramirez. Miss Ramirez, if I find all my flexors on the anterior forearm, where do I find all my extensors?
On the posterior side.
Yeah. Thank you, Miss Ramirez. That's perfect. Yeah.
I have a question. So, technically, I mean, I don't know if this even sounds right. So the ulna is like by the pinky.
Yeah.
And so that would be the anterior side, even though if it's like, no?
Technically, it's your medial side. I know that's really confusing, but if I'm in anatomical position, technically my ulna is on my medial side. It's more medial than lateral, yeah. I hope that wasn't confusing. But it's also the bone that runs from my pinky and actually makes your elbow. Your olecranon process is your elbow, everybody, and your olecranon process is part of your ulna. It is a bump on your ulna. Your elbow is your ulna. When you are elbowing somebody, you are olecranon processing them. When you are elbowing somebody, you are ulnering them. Don't ever say that, though, again. And let's forget I said it. Okay. Thank you, Mr. Ramirez.
Yeah.
Awesome. Okay, guys, let's release your homework. I've already released it, actually. You have 2 pieces of homework. You have some questions about the brachialis and the anconius and the pronators and supinators. And you have a video about flexors and extensors that I hope really just repeats everything I told you about flexors and extensors. I made a really big deal today about flexors and extensors and digitorums and polycyses and digiminimes and brachioradialis and ulna, that I made this really big deal would answer any question probably that you would get about forearms or hands on the test at the end of the year. Because I think it's really valuable information that will stick with you forever. Yeah? All right. Okay, everybody. That's it. Work on your homework. I'll come back and check in on you before we close. If you are auditing this class, if you're just watching it, you probably want to drop off now. You're not going to see anything interesting at this point, except people with their heads down in books and things like that. Yeah? Awesome. But thank you for being here.